Hey there, it's Dr. George Forgan-Smith here, and I just wanted to give a brief overview of PrEP. There is going to be an increased signal when it comes to PrEP with it having been released under the PBS. So I just want to give this a very quick synopsis on PrEP, and this way you'll have an understanding about PrEP if a patient comes to you asking for further information. So, what is PrEP? So, PrEP is a single tablet that when taken every day, it can reduce the risk of HIV infection significantly. It's a medical prevention and it's really designed for people who are at high or medium to high risk of HIV infection. It's a single tablet, two drugs, tenofovir and emcitriptine, which is marketed under the name of Truvada. However, the PBS application has included generic versions of this drug. When successfully taken every day, 7 tablets a week does reduce the risk of HIV infection by 99%. People who should consider PrEP are people who are at medium to high risk of HIV infection. This includes people whose partners are living with HIV but have not been able to achieve a non-detectable viral load. People who have condomless anal sex, and this is men who have sex with men, but also trans people as well. Within the heterosexual community, if people are heterosexual and have HIV positive partners, it is absolutely worthwhile considering PrEP as well. People who use IV drugs or methamphetamine are also at a high risk of HIV infection, as well as people who have had recent rectal chlamydia, gonorrhea, or syphilis. These are high risk infections that are highly associated with the acquisition of HIV. People who should not take PrEP are people who are already HIV positive. People who are living with HIV should not be on PrEP. They should be on HIV treatment, and these are two very different things. The other group of people is people who have very significant renal impairment or at a high risk of renal impairment. It's very important that starting PrEP with them is done carefully, and I would recommend doing it with a prescriber who is very familiar with PrEP. You do have to take care with some groups of people, in particular, people who have had a potential exposure to HIV in the last 72 hours. It's important that this person has a careful evaluation as to whether or not they need to be on a different treatment called PEP, or post-exposure prophylaxis. This can be done through an S100 prescriber, a HIV prescriber, or your local sexual health organisations. People who have had a potential exposure to HIV in the past 30 days do need to be carefully monitored. If there's any signs of seroconversion, you need to be very careful about the management of their care, and I would recommend talking with a PrEP prescriber who is very familiar at that time. People who are living with hepatitis B, a little bit of extra careful monitoring there, because one of the drugs in PrEP is also used to treat hepatitis B. So while they're on PrEP, that can bring down the hepatitis B, but coming off PrEP, hepatitis B could flare up. So this does need to be carefully managed. People who are at risk of renal impairment or who are at higher risk of renal impairment, i.e. people who are diabetic, people who are on drugs that can affect the kidneys, it's important that you keep a very close eye on their renal function, and if it starts creeping towards that magic number of 60, it's very important to carefully monitor, and you may need to adjust the dosage regime at that time. People who have a family history or a personal history of osteopenia or osteoporosis, it's probably worthwhile organising a bone density scan before starting PrEP and on regular intervals during PrEP. One of the drugs in PrEP has been associated with a slight increased risk of fracture, so it's very important. People with issues with bone density, keep a close eye on them. When you're starting PrEP, you need to get patient consent. This patient needs to have a full understanding of what they are in for. I have a PrEP video that I use for consent, and I will include a link in the description of this video. You have a look at their medications and any potential interactions, but mainly if they're diabetic, but also have a look at any drugs that can affect renal function as well. Now, as part of the screening testing, you will be checking the person's HIV status, their hepatitis status, as well as a full sexual health screening, and do include hepatitis C because that is now considered a potential sexual transmissible infection. When you are starting PrEP, it's very important that the patient understands that they need 7 days worth of medication inside the body before it is considered protective against HIV. There can be a bit of gut disturbance. Some people get it, some people don't. I often recommend acidophilus yogurt during the first couple of weeks of starting PrEP, and it can help it a little bit. However, it tends to be not significant in many people and it wanes away quite quickly. It is important to reinforce that condoms are part of the strategy. Whilst the PrEP will protect against HIV, condoms add an additional layer of protection against other STIs. So it is important to reinforce the idea that condoms can still be a useful adjuvant to PrEP. And also talk about ways that you can help a patient take the tablet every day, whether that be alarms on their phone, setting up a routine, help people take their tablets. When people are starting to take PrEP, it's important that they get hooked into a regular routine where they get checked every 3 months. And as part of that screening, there is going to be a kidney function test and a full sexual health screening. It's also a really good chance to talk to the people if they've been able to take the tablet every day and whether or not they've had side effects. Some important things is that if somebody is HIV positive when they're doing the initial screening, don't start PrEP. They need to be started on HIV treatment, and that needs to be done carefully with an S100 HIV prescriber. If somebody becomes HIV positive during the PrEP journey, again, it's very, very important that you get this person seen by a HIV prescriber, an experienced PrEP doctor, because long-term use of PrEP in somebody who's HIV positive can lead to resistance to some of the future treatments for their HIV infection. If somebody wants to stop taking PrEP, it's important that they have 28 days of tablets after the last potential exposure to HIV. So that's an important one. And keep a close eye on renal function. We know that there can be a slight drop in renal function after coming off PrEP that normally goes back to normal. However, if it continues to dwindle, it is important to have a chat with a HIV prescriber about options that are available for you. You can learn more. I've got a website, isprepforme.com, and there is a section there that's devoted just to doctors who want to learn more about PrEP. But that website also has my consent video. It also has 47 of the most commonly asked questions I have received about PrEP answered in video format, and the patients really, really like that. ASHM is a fantastic resource, and I cannot recommend enough the S100 prescribing course. It's a wonderful course and you can learn so much. If you're interested in gay men's health, you're interested in HIV or HIV prevention, this can be a fantastic course for you. So there you go. That's a brief introduction to PrEP. I hope it was helpful, and if you are interested or have questions, I'm happy to field them. Have a fantastic day.